In this video, I would like to talk to you in everyday language about what exactly is the Rothbart's foot. The Rothbart's foot is an inherited abnormal foot structure that often is the cause of chronic muscle and joint pain throughout the entire body. The Rothbart's foot is formed during pregnancy. It is an incomplete development of the talus bone, which sits on top of the heel bone. That is, the talus bone does not completely grow and unwind as it should during the course of pregnancy. Let me demonstrate. When you are a tiny embryo in your mother's womb, your feet appear as stumps, and the bottom surfaces of the feet are facing upwards towards the head. The stumps start to grow and elongate, and the feet begin to grow and form. At the same time, the feet start to rotate inwardly. The bottoms of the feet are now facing each other instead of the head. Between the 8th and 9th week of pregnancy, the bottoms of your feet have rotated so they end up facing south, in the opposite direction of your head, and they will stay that way throughout the rest of pregnancy. But if you have a Rothbart's foot, your feet will not complete the rotation of development, and your feet will not end up facing south, away from your head. In other words, your feet may end up facing here, or here, or here. You may be asking yourself, how does this incomplete foot development cause chronic pain? To answer this, we need to look at the structure of Rothbart's foot after you are born. The Rothbart's foot is characterized by an elevated and inwardly twisted big toe and first metatarsal. But by looking at your foot, you will not see your elevated and twisted big toe and first metatarsal. The reason is because it is only apparent when the rear part of your foot is placed into its anatomical neutral position. Placing your foot into its anatomical neutral position can only be accomplished by someone who is trained to do this.